Hi, I'm Dr. Shruti Tannan. I'm a board-certified plastic surgeon in Raleigh, North Carolina, and I am so excited to see a paper about Journavx come out this year in plastic surgery and plastic reconstructive surgery. So we have been using the Journavx in our practice now for the last month, and I just want to echo what the authors are saying in this study. So let me tell you a little bit about the medicine, what we're excited about as plastic surgeons, and what that means for you as a patient. So this medicine, the Journavx, works on the peripheral nervous system. So at the level of your nerves, messages get sent to your brain, like pain, for example, like if you touch a hot stove and you're like, oh my gosh, that's hot, that pain signal goes back to your brain. And the way that signal is sent by changing the electrical signals, literally. And so there's a voltage gated sodium channel that this medicine blocks at the peripheral nervous system. It's highly specific for your peripheral nerves. And that's really important because other medicine alternatives that your surgeons have are essentially narcotics for that severe pain, not the mild to moderate pain. And narcotics work at the level of your brain, and that also has effects on your stomach and your GI tract. As you know, you can get constipated, get nausea and vomiting, taking it on an empty stomach. Plus the effects on the brain, you can feel sort of loopy, out of it, sleepy. There are so many side effects with oxycodone, not to mention, no one wants to get addicted to it. So I've had a lot of patients say, I don't really want to take it. It's not working for me. And what's the alternative? And this is an excellent alternative. We have been using it in our practice. And my hope is that with this paper coming out, that more plastic surgeons will start asking about it, learning about it, reading about it, and investigating it for their own patients. So what's interesting is that these studies show that the patients taking the Journavx, when compared to people on narcotic pain medicine, these patients on Journavx had less nausea, vomiting, certainly didn't feel drowsy. You can on the oxycodone. And I will tell you, in our practice, we've seen the same thing in the last month. This is the first drug to be approved by the FDA in 20 years for pain that's not a narcotic. Just to kind of put in perspective, this is pretty groundbreaking stuff. And so if you're about to have surgery, I highly recommend you advocate for yourself. And if you're not being prescribed this medicine, why don't you have a conversation with your surgeon and say, hey, is this something that I could take? Would it be safe for me? Would it be indicated with this surgery? Follow us for more. Let us know if you have questions in the comments.